Hello, everyone. My name is Tristan Edwards, and I am a student PTA from CBD College. And today I'll be presenting on MECP2 duplication syndrome, which is a rare and complex neurodevelopmental disorder. So we'll explore its etiology, clinical features, the normal anatomy versus the pathophysiology, along with functional impact and physical therapy management, and the appropriate interventions across the lifespan of patients who have this disorder. So, what is MECP2 duplication syndrome? It is a rare genetic condition caused by the duplication of the MECP2 gene, which is located on the X chromosome. So, this in turn primarily affects mostly males because males only have one X chromosome and are more susceptible to the effects of overexpression, which in turn can lead to challenges in development, movement, and also other health conditions. Two typical patient profiles would include young boys who show early developmental delays, things like trouble sitting up or crawling, and another would be older children who may have difficulty walking or have frequent infections and possibly seizures. So, risk factors. There are two types of risk factors. One being non modifiable, which are things that can't be changed. Another being modifiable, which are things that can be changed. For this syndrome specifically, a non modifiable risk factor would simply just be being a male. Since males only do have the one X chromosome and don't have the other chromosome to balance this gene, this is why it primarily affects males. Another would be just the family history of having this disorder, especially from the mother's side, because mothers are primarily the carrier of this gene and can be passed out onto their children. Um, so some modifiable risk factors are limited in this case, but some things that can be done are just genetic counseling before pregnancy can help families and understand the risk of this syndrome. Some other things would be early testing and interventions that can improve quality of life, even if the gene can't be changed. This might include supportive care to slow disease progression or complications. Some examples would be early physical therapy to prevent contractures, improve posture, and maintain mobility. Also, speech therapy to support communication and feeding. And some other examples would be occupational therapy to improve activities of daily living, and also respiratory management for airway clearing techniques. So, the normal anatomy versus the pathophysiology of MECP2 duplication syndrome. Um, in a typical brain, the MECP2 gene helps regulate gene expression in the brain. It plays a critical role in the synapse formation, brain plasticity, and neurological stability. However, with the duplication syndrome, the overexpression of the MECP2 gene disrupts this balance, leading to neurological dysfunction. So, the duplication of the MECP2 gene leads to abnormal overproduction of the MECP2 protein, which in turn causes the impaired neuronal signaling, synaptic dysfunction, and developmental delays. So, two major effects from the cause of this would be neuromuscular dysfunction, such as hypotonia and intermittent spasticity. Another would be cognitive and communicative impairments, often with severe intellectual disability and limited speech. So, clinical manifestations or signs and symptoms of MECP2 duplication syndrome. Um, Patients often present with hypotonia and delayed gross motor milestones, such as trouble walking or standing, difficulty using hands for tasks like holding toys or feeding themselves, challenges with balance and posture. Seizures are something that is recurrent and often difficult to control for these patients. Um, Recurrent respiratory infections, intellectual disability, and speech impairments, such as delaying communication and social interactions. A lot of gastrointestinal issues such as reflux or constipation, and and for the most part, these symptoms can range from moderate to severe and typically worsen with age. So, the impact on function with patients who have MECP2 duplication syndrome. Patients experience challenges in mobility, communication, and daily living activities. Many of these patients are nonverbal, wheelchair bound, and dependent on caregivers for transfers and ADLs. So the long-term goals for these type of patients are usually just focused on preserving the quality of life, preventing decline, and enhancing comfort and engagement. So four things that physical therapy would do for patients with MECP2 duplication syndrome is just sitting balance and um, postural control, just focusing on transfers with like the bed and the wheelchair, also weight bearing with standing, and most importantly, mobility, walking, assisted walking with an assisted device, or using a wheelchair. The patient I was helping with um, was able to walk at one point without any assisted device, then was hospitalized for a sickness, respiratory sickness to be specific, and it set him back um, pretty far. Um, so he had to be wheelchair bound. And when we were working with him, we were able to get him to stand, take some steps with the gait belt, of course. So he was able to do that. So you started to see the progress within just that short amount of time of us seeing him, and the goal of him possibly getting back to walking without any assisted devices. So the evaluation I was not personally a part of initially with the physical therapist. However, I was able to get some information of some things that they might use and what they did use to evaluate this patient. Um, the physical therapist told me that they were assessing for motor function, tone, posture, mobility, and some things they used was a gross motor function measure. They also evaluated passive and active range of motion and postural control and trunk stability. Um, some things that I researched on that they did not use in this specific case was a modified Ashworth scale for spasticity and a PEDI or WE-FIM for functional mobility. Um, they personally did not use that, but it is something that is used in the physical therapy world for patients with this syndrome. So the prognosis of the physical therapist was that he is severe. Before, I guess he wasn't as severe. Like I said, he was able to walk on his own at some point. But once he was hospitalized, it really set him back. He's in a severe state since he is now wheelchair bound. However, um, when I came to help with this patient, he was, I think, a couple sessions in, maybe two or three. And by that point, he was able to start walking with assistance, of course, the gait belt. He would take steps around the facility and then take breaks in between. He was able to sit on the floor. He was able to lay down, and he had some functional mobility. With obviously with assistance. But the physical therapist goal was to get him back to just being able to be a bit more independent with his gait. Another thing with this patient, he was nonverbal and has always been nonverbal since he was diagnosed with this condition. He does take verbal cues though, and he's able to understand certain verbal cues, and he's able to use certain nonverbal cues, as in nodding the head yes and nodding the head no. Those are some things that he was able to do and was able to use for communication between him and the therapist. So, some things we can do in the acute phase for patients with MECP2 duplication syndrome. One would be just gentle stretching to reduce stiffness, positioning, and caregiver education to prevent joint problems. Also, some breathing exercises or some postural drainage to help with lung function, since these patients are very susceptible to lung function impairments or infections. Um, some things we can do in the subacute phase is, as long as the child or the patient is medically stable, but would still need frequent therapy, would be assisted movement training, like using parallel bars for gait, and for standing and things like that. Some sensory stimulation to improve awareness and reaction, such as stepping on in place on a balance pad, would be another. And starting small strength exercises, such as sit to stands with close supervision. In the chronic phase, for long-term maintenance, we can focus on mobility training and like using walkers and braces or even wheelchairs to be able to get around um, functionally, mainly on their own, maybe with some assistance. Um, Also focusing on fine motor exercises for hand use, such as playing with the ball or, if possibly, maybe even kicking a ball, depending on the patient and where the patient is at in their phase. Another and probably one of the most important with these type of patients would be family education. People who are around the patient and taking care of the patient, just knowing what to do to support their activities at home and reduce stress in the caregiver of these patients, and able to reduce the stress of the family who are um, mainly taking care of these patients in this scenario. Patients with MECP2 duplication syndrome are rare but also prevalent in the physical therapy world. So, just being able to maintain daily function and improve quality of life overall using exercise and relevant functional tasks, um, for patients with this disorder is the goal for them, and also their surrounding loved ones. There's plenty of research on this disorder, and more information surrounding this syndrome seems to grow daily, which includes the ever expanding treatment options for these patients.